Hello everyone, welcome to my channel. Hope you all are doing well and spending some quality time for your exam preparations. So today our topic is heart failure. I know all of you have a clear idea about heart failure because this is the one of the frequently asked question area for all of the nursing exams. It's not only for any comprehensive exam. If you are writing an exam in university also, definitely you can expect one or two questions related to heart failure. So we will just have a brief explanation about some of the main points and signs and symptoms. Then we will move to the questions. So let us start. What do you mean by heart failure? What is the small definition or the point that is in your mind? Inability of the heart to maintain adequate circulation to meet the metabolic needs of the body. That is very simple. We know that the heart should work properly. There should be enough cardiac output. Then only our body can perform all the activities very well. So when the heart is not able to do this proper work, or when the heart is unable to produce the proper circulation, what will happen? If the body will not get enough blood to fulfill the metabolic needs. So that's the thing happening in the heart failure. Now we will see what are the types of heart failure. Mainly we have two types of heart failure. Right ventricular heart failure and the left ventricular heart failure. And also we will classify as chronic and acute heart failure. Acute heart failure, you know that it will occur within a short period of time. Maybe the client is already diagnosed with a chronic heart failure and he is very compliant with the medications and he is in the home. But maybe some kind of issues or some other infection, or maybe the client is not properly maintaining the things what is instructed during discharge, there is a chance of exacerbation. So in that case, the client will come to the emergency as a case of acute exacerbation of congestive heart failure. And that one, another one, chronic, you know, the other body systems and other problems, the client is already diagnosed for a long period of time and is following all the treatments. That is the common acute and chronic type of heart failure. The main thing, the questions usually come from the right ventricular heart failure and the left ventricular heart failure. So what is happening in the right ventricular heart failure? We know that how the heart circulation is happening. I know some of you have idea about that. From where the blood is, heart have mainly four areas, four chambers. The right atrium, right ventricle, left atrium and the left ventricle. We know that it is starting from the right ventricle. So from where the right ventricle is receiving the blood, from the superior vena cava and the inferior vena cava, the deoxygenated or the bad blood in the body is coming to the right atrium. Once it will come to the right atrium, it will go to the right ventricle. So in the right ventricular heart failure, what is happening is, if the right ventricle could not able to work properly or it will not contract properly. So what will happen? If the blood coming from the all parts of the body through the inferior and superior vena cava, that will be back up in the place where it is coming. Which means we know that it is coming from the all part of the body, that is the deoxygenated blood coming to the right atrium and coming then move to the right ventricle, and it's supposed to go to the through the pulmonary artery, it will goes to the lungs. That is the proper circulation happening. But through the problem of the right ventricle, because of the problem of the right ventricle, or the right ventricle is not properly contracting, the blood where it coming, it will back up there. So what will be the signs? You know that the blood is coming from the body parts. So where that blood will be back up there. So once it will back up, what will be the symptoms? We know that the right ventricle back up and the blood will be accumulate in the other parts of the body, like the abdomen. We know that the client will be presented with an ascites and the splenomegaly, enlargement of the spleen, hepatomegaly, enlargement of the liver, and also the client have nausea. Then the another one, that the client have a very huge pitting edema, especially in the lower extremities, and the jugular venous distension. How you will assess the jugular venous distension? What would be the position? There is some questions related to that. The client should be at least in a 30 to 45 degree angle, Fowler's hypervolous position. That is the position usually we are using to assess the jugular venous distension. So these are some of the common symptoms that you can see when a client will diagnosed as right ventricular failure. See in the picture you can see how the symptoms and the dependent edema. Then all the symptoms in the right ventricle, it will be presented as the systemic symptoms, because we know that the blood is coming from the body, that is the deoxygenated blood, and that is coming from the body. So the body, all the symptoms will show. Then we will move to the left ventricular failure. So what is happening in the left ventricular failure? Now we taught the right ventricle is not properly contracting. Okay, in the left ventricular failure, there is no problem with the right ventricle. That is fine. And from the right ventricle, the blood is going through the pulmonary artery and it will reach to the lungs. So where in the lungs, the deoxygenated blood will be oxygenated, and that oxygenated blood from the lungs, it will come to the left atrium, then will come to the left ventricle. So that is the proper circulation. I will explain once more. From the superior and inferior vena cava, the blood will come to the right atrium. Then from the right atrium, it will go to the right ventricle. Then from the right ventricle, it will go to the lungs through the pulmonary artery. Then from the lungs, it will be oxygenated. Then that oxygenated blood, that good blood, will come to the left atrium. Then will move to the left ventricle. Then from left ventricle to the aorta and to the all parts of the body. So that is the circulation. So now already we see what is happening in the left ventricular failure. So now we are moving to the, already we see right ventricular failure. Now we are moving to the left ventricular failure. So when the left ventricular failure, there is no problem with the right side. Once the blood is reached into the lungs and it is oxygenated, now it is coming to the left atrium. Once it's come to the left atrium, it will automatically move to the left ventricle. But here what is the problem? The left ventricle could not able to contract properly, or the left ventricle is not working properly. So what would be the result? The blood will not go to the aorta, and the blood will not reach the other parts of the body. The other parts of the body should need an oxygenated blood to work properly or to meet the metabolic needs of the body. But because of the left ventricular failure, that blood will not go to the aorta or will not reach the body parts. It will be back up in the lungs. So we told that in the right ventricular failure, the blood will be back up in the rest of the body, whereas in the left ventricular failure, the blood will be back up in the lungs. You can connect left is equal to lungs, L is equal to L. So once the blood will be back up in the lungs, what will be the symptoms? Well, if you know that dyspnea or difficulty breathing or shortness of breath, then crackles, then another one like orthopnea. The client could not be able to sleep properly in a supine position because of the shortness of breath. And some other problems, it will again the client have related to the left side of the where the lungs will work up. So these are the, and another one is like cough. Then there is an adventitious breath sounds. Then tachycardia, and sometimes the client will be presented in the emergency as a dyspnea on exertion. So we have to do the proper assessment. And through the assessment we can find out, okay, this client have the left ventricular failure, or now it is admitted with the acute exacerbation of the congestive heart failure. So these are some of the main concepts related to the left ventricular as well as the right ventricular failure. I hope the signs and symptoms it's clear to you. We told that the left ventricle connected with the lungs and the blood is back up at the lungs. Right ventricle connected with the rest of the parts of the body, and the blood backup will be in the rest of the body parts, especially in the lower extremities and the abdomen, ascites, hepatomegaly, splenomegaly, nausea, and all those symptoms. Then the another main symptom related to heart failure is that the pulmonary edema. Sometimes the questions will be related to the pulmonary edema, so we might be confused, okay, how it will be connected. In the pulmonary edema, main some of the signs and symptoms are acute restlessness. The client will be presented with restlessness. Then it's like anxiety, crackles, pallor, orthopnea, diaphoresis. So these are some of the main symptoms only we can connected with the pulmonary edema. But this dyspnea also there in the left ventricular failure. But some cases in the question they will not present it's left ventricular or right ventricular. It will be question will be connected with the pulmonary edema. So that time you should have an idea. Okay, what are the signs and symptoms in the pulmonary edema? I hope what do you mean by the heart failure and how these two types is differentiated in terms of its signs and symptoms and what is the symptoms connected with the pulmonary edema. I hope it's clear to everybody. Okay, now we will move to the management, the common management of the heart failure. The first one is that they place the client in a high focus position. We always know that because of this fluid filling and because of the dyspnea and everything, the client is very difficult to sleep in a very spine position. So provide the client a high focus position, comfortable position. Then the rest periods between the activities. There should be an enough rest periods between each activities because the body is not getting enough blood or enough oxygen to meet the metabolic needs or to fulfill the activities properly. So we should place the activities with a proper gap or the rest period so it could be able to perform. Then provide a very calm environment, administer oxygen as prescribed, then suction the client as PRN, then monitor vital signs frequently, watch for orthostatic hypotension, then strict intake and output, daily weight checking. Okay, here we will talk some points. Daily weight checking is the very important aspect. Maybe the client is already diagnosed with heart failure, chronic heart failure, and is going to the home. You already gave the discharge instructions related to medications, everything. The same, along with that, the health teaching should include the daily weight checking and its significance. The weight should be checked in every day and it should be in the same time. And while checking the weight, the clothing should be same. And also, if there is a increment of 3 pounds within 2 days or 3 to 5 pounds within a week should be informed to the healthcare provider or to the physician because that shows if the more fluid is accumulating in the body. If it will not take precautions or will not inform the healthcare provider, it will lead to the exacerbation of the condition. That's why the weight checking is very important and I have found most of the questions are related to the weight checking and the fluid restrictions. So this point is very important, strict intake and output, daily weight checking, fluid restrictions. We know that the fluid restriction also very important because already the fluid, everything is filled up in the body and there is edema. So we should limit the intake of sodium also because if the more sodium that will leads to more fluid retention. Then the use of any non-steroid NSAIDs or non-steroid anti-inflammatory drug is contraindicated as they may lead to sodium retention. So the NSAIDs is very contraindicated in the case of heart failure. That is also so while we are giving the health teaching, we should inform the client. Don't take any over-the-counter NSAIDs. You should consult with the doctor before taking anything. Then the another points, some of the medications related to the heart failure management like diuretics. We know that the common diuretics used in heart failure is furosemide. What is the side effect or the complication of furosemide usage? There is because the furosemide is a potassium binding diuretic. So what will happen? The fluid will come out, along with the fluid, the potassium also will deplete. So there's a chance of hypokalemia. So there should be a proper monitoring of the electrolytes. Then the another one is vasodilators, AC inhibitors, beta blockers. Then administer distylis as prescribed. So these are some of the common medications used in heart failure. And while we are studying, we should have an idea. Okay, this medicine would be the side effect. And why the client is presented with the hypokalemia, or when the question they will ask, okay, this client is taking furosemide and what would be the symptom or what would be the thing the nurse should take priority to monitor in the electrolytes, especially the potassium because of the chance of hypokalemia. Then the health education instruct the client about the modifiable risk factors. We know that there are risk factors related to heart failure. The client should have a proper diet management, exercise, and some of the lifestyle might be some of them they have a moderate like a sedentary lifestyle, so that should be changed. Then teach the client to avoid over-the-counter medication that we already mentioned, especially the NSAIDs. Then medication complaints, it's very important because we have given all the instructions and the client is now fine, he's going back to the home. Once he will reach to the home, he should be very consistent with the medication what he is taking. If he will not following a proper compliance with the medication, there's a chances of exacerbation and present to the decompensated heart failure. So that is very important. Then the other one is follow a low sodium, low fat and low cholesterol diet. Very important, low sodium, should be limit the intake of sodium, should not be more than 400 milligram. Then the another one is instruct the client to balance the activity level. That also we already told. There should be an enough rest period between the activities. Then the weight checking also we already mentioned. So these are some of the common management and the medications related to the heart failure. So now we have studied what is the heart failure and how the classification and what are the difference between the left side and the right side heart failure in terms of its signs and symptoms. Then what are the common management, especially daily weight checking, then avoid the NSAIDs, then limit the intake of sodium, fluid restrictions, everything. Okay, I hope it's clear to everybody. Now we will move to the questions. So the first question, a client with newly diagnosed chronic heart failure is being discharged home. Which statements by the client indicate a need for further teaching by the nurse? Select all that apply. So first of all, this is the select all that apply question, and the question asking for a bad statement. That's why we should provide further teaching. See, here you can see that is a keyword. Whenever you are reading the question, you should read carefully, at least read 1 or 2 times, so you will get an idea, okay, whether I am looking for a complication, whether I am looking for some of a good statement, or I am looking for one of the serious adverse effect of particular medication. In this scenario, they asked the client, okay, now actually he admitted with the newly diagnosed chronic heart failure and now it's okay, he is going back to his home. Upon discharge, the nurse should give certain instructions. So after receive those instructions, the client, she makes some statements that is not correct. That's why it need further teaching by the nurse again. So we will see what is the wrong statement out of the 5 options given. That wrong statement will be the answer. So when that client will make this wrong statement, the nurse will understand, okay, the client, he didn't clear with the things what she taught or what he taught. So the nurse again clarify or again teach the client. I hope it's clear the question. Now we will read the options. Option 1, I don't plan on eating any more frozen meals. Option 2, I plan to take my diuretic pill in the morning. Option 3, I will weigh myself at least every other day. Option 4, I am going to look into joining a cardiac rehabilitation program. Option 5, ibuprofen work best for me when I have pain. So we see the 5 options. What would be the wrong options? What do you think which could be the right answer? Or out of these 5 options, which are the wrong statement made by the client? We'll see the first one. I don't plan on eating any more frozen meals. So what do you think? Does that a correct statement? Of course, it's a correct statement because we know that the frozen meals are often high in sodium. We told that the client should limit the intake of sodium because the most heart failure clients are instructed to limit the sodium intake. All foods high in sodium should be avoided. They should not take more than 400 milligram per serving. That we already mentioned while we are studying the interventions or the health teaching in heart failure. So the client, okay, he know that there is sodium, that's why I will limit or I will not take the frozen meals. So that is the correct statement. So no need to give further teaching when the client will make this statement. So that is fine. So if the correct statement means that is not our answer, the wrong statement will be our answer. The next option, I plan to take my diuretic pill in the morning. What do you think? Does that a correct statement? Of course, it is a correct statement because we know that when the client will take the diuretic pill, obviously he will pass the urine. So if he will take in the morning, it will be better for him to go to the washroom. If he will take this pill in the night, that will interrupt his sleep and nocturnal, like there is problem with the sleep, and also client may feel more discomfort when they will not get enough rest. So it is best to take this medication in the morning. Then the another option says, I will weigh myself at least every other day. What do you think? What we studied? We studied that the client should take the weight every single day. And it should be in the same time with the same amount of clothes. Today the client, he took his weight, and tomorrow he is taking his weight with another cloth, especially maybe he is using extra layer of cloth. Though we could not say that, or we cannot say that there is a change, because it might be because of the dress what he used. That's why we should mention the client should take the same amount of cloth while he is taking the daily weight. So this is a wrong option. If the client will make this statement, I will take the weight every other day, this is a wrong statement. So that's why option 3 is our answer. So option 1 and 2 we eliminate because that is the correct statement. Option 3 is the wrong statement, so that is our answer. Now we will see the another option. I am going to look into joining a cardiac rehabilitation program. What could we see? Okay, that is a correct statement. Is that right? Because we said that some of the risk factors, and they have to change their lifestyle, they have to involve some exercise, they have to maintain a proper diet. So if the client have an idea to joining a cardiac rehabilitation program, that will definitely help to combines with the medications, and that will definitely help to maintain his quality life. So that is also a correct statement. So we eliminate option 1, option 2 and option 4. We got only the answer as option 3. We have one more option. Ibuprofen works best for me when I have pain. What do you think? Does that a correct answer? No. No, is that a correct statement? No, it is a wrong statement. So that is our answer. Why it's a wrong statement? We already said that the client should be avoid taking any over-the-counter medication, especially the NSAIDs, because that will leads to the sodium retention, fluid retention. That's why the client should avoid the intake of any of the NSAIDs. So what are our answers? I hope it's clear. Our answer are option 3 and option 5. Here you can see the clear explanation of each point. We have already discussed, but if you want to make a note, you can just pause in between and you can make your own notes by looking the slides. So our question 1 is clear to everybody. Let us move to our next question. The nurse is admitting a client with a diagnosis of right side heart failure resulting from pulmonary hypotension. What clinical manifestations are most likely to be assessed? Select all that apply. Again, it's a select all that apply question. Because why I discuss more questions in select all that apply type, because the students, they are getting more questions in this pattern. So if you'll practice more, this type of question definitely will help you to pass your exam. So we'll read where the question. This is a right heart failure client, and that is resulting from the pulmonary hypertension. So what are the symptoms that we can expect, or that I should or the nurse should assessed, most likely assessed. We have already studied what are the main symptoms in the right heart failure. So we'll see. Crackles in lung bases. What do you think? Does that have an answer? We said the crackles where we will listen. The lungs problem where we can see. Left heart failure. Here the condition is right heart failure. So we can eliminate option 1. Then another option is increased abdominal girth. Yes, that is the correct answer, because we said that the client have ascites. So when the ascites, we know that the huge belly, is like very distended abdomen. So option 2 is the correct answer. Then option 3, jugular venous distension. Yes, that is also a correct answer. When the client have a right heart failure, they have a signs and symptom of jugular venous distension. Then the another one is lower extremity edema. Okay, that is also correct answer. We said that when the client have right heart failure, most of the symptoms are systemic, and that will be in rest of the body, from where the blood, deoxygenated blood is coming. So the blood will be pooled. There will be a huge edema in the extremities, especially the lower extremities. Then orthopnea. Orthopnea we saw in left heart failure. When the client have shortness of breath or dyspnea, they couldn't able to sleep in supine position. That is the orthopnea. So this is the option 1 and option 5 we will see in left heart failure. So that is not our answer. We can eliminate option 1 and option 5. So our answers are option 2, 3 and 4. Does that clear? So in this part we have discussed everything about the heart failure, and also we have discussed 2 questions. I hope we have a second part of this same heart failure topic. In that we will discuss some more questions. So I wish you all the best to everyone. Prepare well and try to practice more questions. Not only select all the reply questions, some critical thinking questions and priority questions. Everything try to practice. Then only we can easily pass the exam. So bye bye.